Hello and welcome to my presentation on work-life, college-life balance, burnout recovery, and prevention. My name is Zalfi Smith, and I am a public health intern with New Mexico State University at the Office of Health Promotion. I wanted to start out by talking about what burnout is. The WHO defines it as a syndrome resulting from workplace stress and specifically identified as a work-related incident. It is characterized by three dimensions: feeling of energy depletion and exhaustion, increased mental distance from one's jobs or feeling of negativism or cynicism related to one's job, and reduced professional efficacy. Professional efficacy is the feeling that comes when you do not think you are successful at your work. An example of this could be that you feel you're not performing to the standards that you should be, or in school related, you could potentially not be doing the best that you possibly can. So that brings us to our burnout phase model. You can see here that it starts off with a compulsion to prove oneself or excessive ambition. And as we travel down our circle here to the darker orange, this can lead up to physical exhaustion that can be life-threatening. So as we start off wanting to, prove ourselves and have excessive ambition, we work harder. We start neglecting our own needs. Then we have displacement of conflicts and needs. We start having no other time for non-work related needs. This leads to increasing denial of the problem and decreased flexibility of thought and behavior. Once all of this occurs, then you experience a withdrawal, a lack of direction, or cynicism. Then this starts with behavioral changes, psychological reactions such as becoming more irritable, experiencing a lot more stress that changes how you handle issues. Then you become depersonalized and start to lose contact with yourself and your own needs. There becomes this inner emptiness, anxiety, and addictive behavior, which could lead to potentially trying to supplement or treat yourself, and this could be alcohol or other substances. Increased feeling of meaningless, so a lack of interest in what you start doing. And then, of course, physical exhaustion that can be life-threatening. So how does work-life balance impact students and working students? School-life balance is important for optimal academic functioning. So if you have more balance with balancing outside things such as family and then work on top of going to school, you'll be able to perform academically to a higher standard. Students often prioritize academics at the expense of personal factors, and this includes relationships, exercise, their overall health and well-being. These are all critical elements for optimal academic functioning, and this can also lead to a decline in academic performance overall. In addition to that, students juggling work on top of school may experience greater challenges in striking a balance. This makes it even more important to develop techniques for burnout prevention. Physical symptoms of burnout can be stress that impacts rates of heart disease, insomnia, oversleeping, weight gain and loss, and lower immune system overall. So how do we change the burnout cycle? I want to start off by providing a few health initiatives and some tools for burnout recovery. The first topic we'll cover will be mindfulness. Second will be exercise. Third will be sleep. Then we'll have healthy eating, time management, and then some additional helpful resources that are offered through the Office of Health Promotion and through NMSU. My hope is that by the end of this, you will see how these all impact your overall well-being and are key tools to burnout recovery. So the first topic we'll talk about is mindfulness. It's a lot more than you think, and if you're anything like me, Practicing mindfulness and taking the time to unwind your mind and kind of focus only on one thing is really difficult, especially when you have 100 things going through your mind. So, mindfulness, I want to start out by defining, and mindfulness can be defined as maintaining attention, awareness on the present moment without making any judgments. When individuals practice mindfulness techniques, meditation, or breathing, evidence suggests there are numerous health benefits, and this includes increased immune functioning, improvement to overall well being, and reduction of psychological distress. In a 2012 survey, 1.9% of US adults practice mindfulness meditation within the past 12 months. Among those who practice mindfulness meditation exclusively, 73% reported they meditated for general wellness and to prevent disease. Out of those that practice mindfulness exclusively, 92% of those individuals reported they meditated to relax or reduce stress. I wanted to show that it's not so far-fetched of an idea, and actually, many people practice mindfulness as a way to reduce their stress. So, I want to bring you to breathing and calm technique. You may say, well, how do I practice mindfulness? Do I have time to practice mindfulness? Well, you can see the benefits here. US adults who completed a 15-minute focused breathing exercise reported a reduced negative emotional response to negative images. So, in this study, compared to the individuals who didn't participate in the exercise, these people actually were able to change their thought process and had less negative responses. This suggests that focused breathing helps improve people's ability to regulate their stress levels. I wanted to also provide here a few helpful apps that have free options that can be used for either iOS or downloaded via Google Play. The Healthy Minds program, our first app, offers podcasts featuring a combination of seated and active meditation. It's free and there's no subscription, and it is funded by donations. The next one is UCLA Mindful app. It's created by the University of California, Los Angeles. It has basic meditation startups in multiple languages, including a wide range videos and a self timer for your own personal meditation. Many of us will have Apple Watch or even a Fitbit, so I wanted to provide some of the apps that are provided through Apple and the Apple Watch. Um, the app is Breathe, and it features scheduled guided breathing breaks with reminders. It also has mindfulness exercise, and it has also a tracker to see how many steps you've taken, and every hour will give you a cue to stand. You can take this cue as a cue to take a break and maybe take a walk and practice some mindfulness. And then, of course, for those of you that utilize Fitbit, Fitbit offers a few free guided mindfulness tools through their tracking apps. Premium members have a greater selection. They also have the first electrodermal activity tracker, which tracks your stress levels and sends notifications, prompting you to take a moment to de stress. Another app would be Insight Timer. Um, the features free mindfulness tracks ranging from 8 minutes to 1 hour, mindfulness tools for all ages, including children. And then, of course, Smiling Mind app is great for parents with children. It's created in Australia and funded by donations, and it features plenty of calming mindfulness techniques that you can practice with the whole family. So you may not have a whole hour to practice mindfulness throughout the day, but here's a few tips on how you can complete a 5 minute once a day breathing technique to help calm you down. This is a part of the UCLA Mindful app and was created by them. So let's take 5 minutes to practice a breathing exercise and practice mindfulness. You'll be able to practice this exercise by clicking on the links below. There is one in English and one in Spanish. You'll start by taking a deep breath through the nostrils for 3 seconds. Hold your breath for 2 seconds, and then a long exhale through the mouth for 4 seconds. And again, this is a super useful tool, quick guided meditation, and it only takes 5 minutes of your time. The next topic I would like to discuss is exercise and the role it plays in reducing burnout. It can be an effective intervention for burnout and stress. So, a study found that participants ages 19 through 69 reported greater positive well being and a sense of accomplishment, including experiencing less psychological distress and emotional exhaustion after 4 weeks of exercise. So, I wanted to provide some data in regards to how exercise impacts your overall stress and how this could impact the effects of burnout. When combining cardiovascular and resistance training amongst participants, a study in Australia found that adults ages 19 through 68 experienced significant effects in less emotional exhaustion, greater levels of personal accomplishment, and reduced experience of high levels of burnout by more than 50%. I ended up putting these numbers in a graph here, and you can see that it shows the percentages of individuals reporting low burnout, medium levels of burnout, and high burnout. So you can see here there's a baseline. They took an overall baseline on where everyone's burnout levels were before the study began. And our baseline is shown in yellow. You could see there were pretty significant amount of low burnout reports, not so much in the medium burnout, but higher levels of burnout in high burnout cases. Then they had two control groups, one with 4 week exercise training and one with 4 week no exercise training. So the 4 week exercise training group, here represented in orange, you can see that over the 4 weeks, they reported higher levels of low burnout and a little bit higher levels of medium burnout, but saw a significant decrease in reports of high burnout. So, as they didn't experience as much burnout or lower levels of burnout, you could see that low burnout was a higher number. And if you look over at the 4 week no exercise, the control group, you can see that they pretty much stayed within the same levels of low burnout, medium burnout, but experienced high levels of high burnout. So, this is a great representation to see how exercise can actually impact the effects of burnout and lower your burnout rate. So, how can we do this? I know many of you lead busy lives, and it's sometimes hard to get a workout in throughout the day. So, we're going to provide a few tips recommended by the CDC to jumpstart your morning workout routine. The CDC recommends that you have at least 150 minutes a week of moderate intensity physical activity. Here are a few examples of what that will look like. The CDC also recommends that you have a more intensive workout at least twice a week for 20 minutes. But if you wanted to just complete your 150 minutes a week, you can complete 25 minutes, 6 days a week of fast walking. The nice thing about fast walking outside is that it increases your vitamin D intake. You get a little bit of sun, it can also improve your mood as well. You can jog, it can be done indoors or outdoors, and that's for 25 minutes, 6 days a week. And then, of course, you can practice yoga. It's great for mindfulness, meditation, and breathing. And you can do this 20 minutes twice a week, 2 days a week. And then for some more intensive workout, you can practice resistance training and focus on strength and training. And this can be done 20 minutes, 2 days out of the week. So NMSU has great fitness opportunities. They offer Aggie Fit. A membership is for employees, community members, and students. Memberships for current students start at $40 a term, and the price depends on the number of credit hours that you're taking. You gain access to the Activity Center, Aquatic Center, and South Campus Fitness Center, as well as access to group fitness classes. Here on the link, you'll be able to find the schedule for those group fitness classes. Some of the group fitness classes that are offered at NMSU are Body Blast, Boot Camp Fitness, Buns and Abs, Step Sculpt, Cardio Combo, Group Rip, Total Body Fit, Indoor Cycling, Mixed Fit, and then of course various levels of yoga. If you're not able to get out or make it to the fitness classes or utilize the activity center or fitness center that NMSU has to offer, you can also find great workout videos at u.nmsu.edu, where they provide a bunch of great resources, such as this video here, for fitness and nutrition. The next item I want to talk about is sleep. So poor sleeping patterns are strongly associated with mental health disorders such as depression and can also lead to more emotional volatility. 90% of people with depression state they experience poor sleep quality. So we should be getting about 7 to 9 hours of quality sleep nightly. So how can we improve our sleep? Well, I wanted to provide some tips for sleep hygiene. You want to be consistent. Being consistent means that you set a routine for going to bed and waking up. You want to set a time in which you'll go to sleep and a time in which you'll wake up every single day. And you want to stick to this schedule because, as though it may be harder to fall asleep at a certain time, waking up the same time every day will eventually get you on that schedule. You can do this by utilizing your phone and actually sets a sleep schedule for you in many of these smart apps, including the iPhone. You want to also create a quiet, dark, and cool sleeping space. So set a comfortable temperature. They say optimal temperature is 60 to 67 degrees for optimal sleep. You can also use headphones and sleeping masks to minimize noise and distractions, especially for those who share living space with either a roommate or live in a family with multi individuals living in the home. And one of the biggest ones, removing electronics. So avoid using electronics such as TVs, cell phones, computers. I know many of us like to sit there and scroll on our phones as we're going to bed, but it's super important that you minimize these distractions so that your body can recognize that it's time to wind down and go to sleep. You can set your phone settings to do not disturb, and also this goes hand in hand with the sleep mode that's on there. You also want to avoid large meals, caffeine, and alcohol before bedtime. So caffeine stays in the system for up to 10 hours, so you might want to avoid caffeinated beverages in the afternoon, and this could help your ability to fall asleep. Another big one would be avoiding alcohol. Alcohol may help you fall asleep faster, but it reduces your ability to achieve deep or REM sleep. And then, of course, eating before bed can impact your digestive system while you're trying to sleep. So you should stop eating 3 hours before bed. And lastly, along with eating caffeinated beverages, energy drinks are not FDA approved and can actually contribute to insomnia. And then, of course, you want to get some exercise. So being active during the day can actually improve your ability to fall asleep at night. They do recommend that you do not exercise no later than 2 hours before going to sleep. And then I want to talk about eating healthy. So these things go hand in hand. Poor sleeping leads to skipping meals, such as breakfast, or lunch and can lead to a cycle of stressors. I find that oftentimes we don't take our lunch break, we don't make sure that we're obtaining the right amount of nutrition that we need daily. So I created a TikTok series called Making My Coworkers Eat Healthy Lunch. And here is the QR code if you want to check out those TikToks. So I want to promote resetting and refueling. Researchers found that workers who took breaks to do something they enjoyed reported lower rates of burnout, while physical hunger can cause irritability and fatigue. So it's suggested that you take a 20 to 30-minute break. And a study actually found amongst children, school children, that it can actually improve test scores. So those children that took a break, a 20 to 30-minute break prior to taking a test, showed improvement in their test scores versus those who did not take that break. You can meal prep healthy snacks or meals if you're on the go. And practicing intuitive eating by recognizing when you're emotionally or stress eating. This can be you're working on something and you're grabbing for a donut or something that's unhealthy, or even emotionally eating when you're feeling sad and you're not actually hungry. So, studies show that intuitive eating can improve mental well being, such as with anxiety and depression. You can also take a walk during your break to decompress so that you can come back refreshed and focus on the task at hand. Also, taking micro breaks between work or studying for a nutritious snack can also improve your overall well being. And then I want to take some time to talk about time management. So it can be really difficult to juggle multiple demands of your career, school, or personal life, and it can be very challenging. But I wanted to provide some successful tips that you may find useful in managing multiple demands and conflicts that come along with school, work, and just your overall social life and family. So I want to start off by allowing you to take time to be where you are. And what this means is that if you're focusing on studying, you are focused on the task at hand. If you are focusing on a project at work, you're focusing on that. And when you're home, you're focusing on your family and that time at home or with yourself and not letting them flow, vice versa. So you don't want to bring work and school home with you. You don't want to bring personal trauma to work and school as well. The next tip is to get organized and set a schedule for the week. So make a schedule and stick to it. Plan your week out to include study time, work, exercise, and other daily tasks. If you take 2 hours during the day to do reading that you may need for your classwork and it's nice and bright outside, you tend to retain information a little bit better. So, just as a side note, try doing some of your coursework reading outside in the sun midday to see if this improves your ability to retain information. Remember to reward yourself. Be sure to reward yourself for completing tasks or small accomplishments to keep yourself motivated. Remember that you're only human, so nothing will get done if you're emotionally or physically drained. Plan exercise and creative activities in your week to help you keep you energized and motivated. Reach out and use your support system. So let your friends and family know your school plans and how this will impact your schedule. Sometimes you may not be able to participate in gatherings as much, or you'll have to manage a time frame where you won't be available on Saturdays because that's your study day. Let them know and have them be your support. And then, of course, learn to say no. Don't overcommit yourself to volunteer work or group gatherings. It's okay to say this is something you can't take on right now. Know that this is only temporary. Eventually, you'll be done with school and you'll be able to have free time or free up your time a little bit more to reprioritize things that are going on in your life. And don't focus on perfection. Don't get caught up on the finished product for work or school projects. Focus on the learning experience and takeaways. It's okay if it wasn't an A plus project. It's okay if there was some feedback that you were able to take and improve for later. Take this as a positive and then move forward to improve for later projects. And then lastly, but not least, have fun. Take time for friends and family, engage in things that you enjoy and that bring you happiness. So it's super important to not completely close off your social network and that you do plan some time in your schedule to hang out with people that you care about. And then as we wrap this up for today, I wanted to include strategies for individuals and kind of tie in everything. Um, they kind of all go in hand: sleep, mindfulness, reducing your stress, reprioritizing your time and your goals. And here's a few tips that can help you get on your way to doing that. Take a day off and create space between work, school, and home. Laugh, practice positive self talk. Adopt a mantra as this too shall pass. Things that are stressful and bad don't last forever, and it's only a moment in time. Along to go away with breathing and mindfulness, use somatic tracking to notice what's happening in your body, and take a breath to remember why you're here. Be in the moment. Facilitate opportunities to show gratitude. If you can make a list of things that you are grateful for, it oftentimes can change your perspective and your thinking when it comes to things that are creating stress in your life. And then, of course, add to that list the things that bring you joy. What are you happy about? What's going on in your life that you're really grateful for and that brings you a lot of joy? Then you can take these negative situations and turn them into positive ones. What can you learn from them? What can you do moving forward to create opportunities for yourself? And then identify what's most important in your life. Do your current goals match that? So identify goals that you have for yourself, and this could be short-term or long-term goals. And are you doing the things and prioritizing the things that are in line with those goals? And if they're not, you can take that time to really think and look at the situation and see how you can start aligning your life and what's going on to these goals. Of course, these are just tips to help you as you start going through your burnout process recovery. But when in need, get help. Seek out counseling when treatment is needed. And I do want to bring awareness to mental health and what you can do to address any mental health issues that derive from burnout. We do have the new Suicide and Crisis Lifeline, which is now available and to all and has access nationwide, and that's by dialing 988. There is also the New Mexico Crisis Line. There's also the National Suicide Prevention Line, and you can dial this number to talk with someone. And NMSU offers different support as well. So there is the Aggies Health and Wellness Center with on-call counselors that are available to talk. There is the New Mexico Crisis and Access Line as well, and they can help is available 24/7. I wanted to provide some additional resources that the Office of Health Promotion offers. So they offer several tips on mental health and well-being, stress, depression, also physical well-being and physical activity, uh, physical screening, so staying healthy, making sure that you're going out and obtaining, your physical checkups. Also, tips for sleep and nutrition. And then, of course, there's some resources for self-care as well. Thank you for listening. And For additional resources and health promotion opportunities, please visit the Office of Health Promotion at NMSU. Thank you so much for your time.